Good morning, friends. You must have listened a lot about mosaic tiles, but you might not have listened about the same concept can be applied in an orthopedic surgery, which is called as a mosaicplasty surgery. This is a very useful surgery in young patients who have cartilage lesions which are moderate to large in size, and typically in those patients who are less in age. So what we do is, if there is a cartilage defect, if there is a defect in the knee which is large enough and which is deep, what we can do is we can take small cartilage fragments from the area which is non-weight bearing or which is not that important, and implant those small fragments in a mosaic fashion to the area which is damaged and to the area which is denuded of cartilage. So when the area where there is no cartilage, you can implant the cartilage fragments. So if you do that, it heals very well over time and you get very good long-term results. When you do it, it looks just like a mosaic tiles, and normally we keep these patients non-weight bearing for some time and then we can mobilize them. There is a good natural healing. The area between the small fragments is covered up with fibrocartilage, and eventually there is a very nice healing of whole of the defect. This procedure is also called as a OATS procedure, that is osteochondral autograft transplant surgery, and we do this surgery with different systems. There are different companies which manufactures this system, and normally we use circular fragments typically of size 4 millimeters, 6 millimeters, 8 millimeters and 10 millimeters, and there are different sets, and depending on the size of lesion we use different size of the autografts, maybe 8 millimeters, maybe 10 millimeters, and we arrange it nicely in a mosaic fashion. So friends, if you have any doubts regarding the mosaicplasty procedure or the mosaic of the OATS surgery, you can write us on the comment box. Thanks a lot.